Alright, so I'm going to do a PEP, and so with that I'm going to use an Ezpap, and so with that it's just to make sure you can do it with a nebulizer treatment, and then it also you can use it to basically get the lungs to clear out any secretions that they may have in their lungs. Alright, so here I have an Ezpap. So the first thing I'm going to do is I'm going to take it out and prepare it. So you're going to hook, with the Ezpap, you'll hook it up to an oxygen device. And so here we have a Thorpe tube, and we'll hook it up to the Thorpe tube. And so once we have it hooked up, and here we have a disposable manometer. And so this is just to see what their volume is. And so this will help us see how far they're getting. And then we can set it at a certain set right here and see if they can get to that where they need to be. So we have a little valve here, and you take this off, take the clip off, and then you're going to connect it with the white piece here to here. And then you make sure that there's a rubber band, so you just try to make sure the rubber band there, and then you would hook it up to here. And then you would turn it on. And then you would have a mouthpiece sitting right here. And so you would set it up so that way you can see the numbers are up here. And so they would take just a nice deep breath in and exhale with the mouthpiece. And then you would place a nose clip on top of their nose. That way we know all of their air that they're breathing in and out is coming through their mouth and not their nose as well. So we would have them have a tight seal around the mouthpiece, have them take a nice deep breath in and out. And so you have like a 1-to-3 ratio, 1-to-3 or 1-to-4 ratio. So breath in and then blow out for 3 to 4 seconds, just depending on how strong their lungs are. And then when you are done, so when you do that treatment and you mark to see where they're at, if they're able to reach that, if not, and then you'll have them take a nice deep cough to try to cough up any secretions that they may have. And if the doctor needs any samples, then you'll take a sample cup and you'll have them cough up, and you'll put that into the sample cup. And then always chart down to see what they cough up, like if they have copious amounts, the color, just a distinction of what they cough up. So when you are done, this is disposable. So when you're done, you would turn off this, remove it from the oxygen source, and then you would remove this mouthpiece like that, and you can dispose of it. Like, these are disposable, and they may need to use this again, so you can keep this until they are finished with their treatments, as this can also be used for the nebulizer treatment as well. There would be a T-piece that you would have at the end, and it would have the medication at the bottom that you'd place in, so that way they can get that treatment for them. So when you're done, always when you do this, you always have a preset. You'd always check their vital signs before, and also listen to their lungs, listen for any crackles, anything like that in their lungs, any sounds of excess secretions that you can hear with that. And then listen at the end to see if it's helping them cough up anything at all, if it's clearing them up. And then I would go and chart on the patient's chart and let the doctor know that I did an Ezpap with them.